I just want to say I'm very excited to be a participant in this webinar. This is really a very innovative advance. It's really the first time, according, at least in my knowledge, where we have a basically non-invasive topical agent that we found in the studies, which I will present momentarily, to be very effective for acne scars, as well as hyperpigmentation and erythema. So without further ado, I'll launch right into it. We all know that acne is a ubiquitous condition affecting up to 80% of individuals from ages 11 to 30 and above. And it's one of the most common diseases in the world. Acne and its sequelae can have a dramatic effect not only on the quality of life for people, but really affecting their social appearance, their anxiety about how they look, and can really have serious psychological effects as well. Condition brings with it a significant likelihood of scarring, which we've all seen, and it's really thought to be the result of suboptimal wound healing due to the acne-associated inflammation. We know there are a lot of therapies out there for acne scarring, including ablative and non-ablative lasers, microneedling with and without adjunctive topicals, such as platelet-rich plasma, platelet-rich fibrin matrix, etc. And then radio frequency has been used, excision, punch excision, subcision, as well as trichloroacetic acid and the TCA cross treatment. So the purpose of the study was to evaluate the efficacy of this topical product for the improvement of acne scar appearance and reducing hyperpigmentation. Basically, the product includes this Retex 5 technology. It's designed to treat acne scar texture, post-inflammatory hyperpigmentation, as well as post-inflammatory erythema. As you can see here on the left, these are the ingredients. It contains medical-grade silicone, azelaic acid, bakuchiol, vitamin C and E, acetylzingarone, as well as licorice root extract. And we'll go into more detail about how each of these products really work to treat the different components of acne scarring. So we did this study at our center in New York. It was a single center, open label clinical trial conducted under obviously good clinical practice guidelines. And we did 4, 8, and 12-week follow-up visits. Patients were healthy, age 18 to 45 years. We had 27 people enroll, only 23 completed, which is actually a very good number for a study. We lost only 4 to follow-up. And though not a specific goal, the subject group included a variety of ethnicities, as well as Fitzpatrick skin types. The exclusions were obvious: no skin conditions such as atopic dermatitis or psoriasis, no history of skin cancer, any pregnant or planning to be pregnant or lactating women, anyone who had changed, started, or stopped hormonal therapy in the last 3 months, and actual planned exposure to UV light within 1 month as well. We actually had them wear a sunscreen just to be sure of that. And also excluding the use of systemic antibiotics, anti-inflammatories, or corticosteroids for more than 3 consecutive days in the prior 4 weeks. And obviously patients with a known sensitivity to any of the products in the topical agent. So again, we did 4 visits, baseline, 4 weeks, 8 weeks, and 12 weeks with follow-ups. And we applied the topical agent twice a day. Patients did it morning and nighttime to the areas of acne scarring. And then they used the Silagen SPF 30 sunscreen after the morning dose if they anticipated sun exposure. And both of these products were provided to the patients. There were no adverse events described or noted throughout the entire study. So really no issues at all. Well, how did we evaluate the results? We did 3-dimensional imaging using a cica-care system, also digital photos. And then we had 3 independent observers, 2 doctors and nurse practitioner, and they looked at the photos. And they were asked if they could correctly identify the before and after photos. What did we find? Well, over 72% of the patient images were correctly identified, as before or after. And we also had patients assess the results as well. They answered a 10-question questionnaire, about their skin appearance at 4, 8, and 12 weeks. And all the same questions were obviously asked at all 3 visits on a 5-point scale, with 1 being disagreeing with the points and 5 being agreeing. And what do we find? 83% of the patients really agreed that their hyperpigmentation and skin texture had improved at 12 weeks. And then we asked them also about the usage of the product, how easy it was, using a score between 1 being disagreeing and 5 being agreeing. And as you can see from this table, people really agreed with most of these statements. So the product was easy to spread. Was it easy to dispense? It absorbs quickly, wasn't sticky or greasy feeling, and the scent of the product was pleasant. So a very positive response, not only to the appearance of the scars, but also using the product, which obviously is very important. If people are not happy or they find the product smelly or greasy on their skin, they're not going to use it. So this was very, very good to hear that the product was really well tolerated. And here you see in a table form the results based on hyperpigmentation, here with the greenish turquoise color being 4 weeks, brown being 8 weeks, and the blue being 12 weeks of follow-up. How much you can see they agree that their pigmentation and texture improved, the scars improved, and the brownish pigmentation was better in all these variables. And then just in terms of general improvement about their skin appearance, they were all very happy with that, as well as their complexion being more even in terms of color and texture. And here you see some nice, these are 3D images. Unfortunately, they don't turn on this PowerPoint, but 3-dimensional imaging, you can actually see, from one side of the face to the other, but certainly you can see the improvement here at baseline where they have significant hyperpigmentation and acne scarring. And look how much better their skin is at the 12-week follow-up. Pigmentation is pretty much gone. Acne scar and texture is significantly improved. And here you see the pigmentation measurements, significantly lighter at 12 weeks. And also in terms of the erythema index, considerably better as well. And we actually found that patients continue to improve even after the 12-week follow-up. Here's another patient. You can see again the significant hyperpigmentation at baseline and scarring. And look at the much, her skin is so much smoother without any pigmentation pretty much. And the scar is obviously much better as well. And again, the pigmentation scale, much better. The erythema scale, look at the major improvement here. Also in erythema, that was actually a little surprising that we found so much improvement, not only in pigmentation and scarring, but also in erythema, which obviously indicates, the amount of inflammation improvement as well. And here's another patient with just a hyperpigmentation improved as well. You can see the pigment is much lighter there too. And also here, the significant improvement in erythema in another patient too. So basically, what do we find in terms of results? That the participants actually rated their results and improvements higher than medical observers. And usually patients are really the harshest critics. And, when they're looking at themselves in a mirror every day, it's really hard to really measure significant improvement. They were able to really quite dramatically. And they noted improvement not only in their appearance, but also the psychologic aspects of the scarring. They felt more confident. They were less likely to hide their skin with makeup. And, they were really generally just overall happy with not just their scars and texture, pigment, and erythema, but also psychologically in terms of their appearance. So in summary, the product was a really important non-invasive advance in terms of topical therapy. It can be used as an alternative to more aggressive therapies like lasers and microneedling. It's suitable for all skin types. We found no changes or any issues with types 1 to 6. High patient satisfaction and ease of use. So obviously this leads to better compliance. And the patients can really expect a visible improvement from regular, correct use of the product. And it really can be positioned as a first-line therapy, or if you wish, as adjunctive treatment to other modalities as well. And here you just see a table with each of the products, so you can see the ingredients in that product and how they work with pigmentation, texture, and then just generally speaking in terms of the skin. So now I'd like to turn it over to Dr. Asztalos, who will talk about how she really has great results in her practice.
So I am so excited to be part of this talk as well, because I've been using the product in the clinical setting for about 6 to 9 months now and have noticed really significant difference in our patients, and they're very, very happy. So yeah, again, I've been using the product for about 6 months, and I see a lot of patients with acne. And specifically acne scarring. After we treat their acne, they come back and they have a lot of scarring and PIE and PIH, and that's a little bit more difficult to treat than the actual acne itself, I think. So I've seen about 200 patients now with acne scarring that I've recommended this product to. I think a lot of colleagues in our group are now starting to use it as well. And patients are super happy. And so I'm going to present a few patient cases. And so this first patient is a 21-year-old female who came in and had some inflammatory acne, but also just a lot of acne scarring and PIE. And so I started her on a few things. Dapsone, we started a little retinol, Eraslo, and then we started her on the Silagen acne scar gel that she used twice a day. And the scar gel was provided to her to use. And she couldn't come in for follow-up, but she took her own photos, so they're a little bit blurry. But even in her photos, you can see what's super noticeable is her PIE, or post-inflammatory erythema, is significantly decreased. And here's her other side. And in the meantime as well, when she came in, she was bitten by, she had a dog bite. So that's what that little piece of skin is on her cheek. And so we had her start using the Silagen scar gel on that as well. And then this is another patient who came in. She's a 16-year-old girl who had pretty awful cystic acne, probably needed isotretinoin, but she didn't want to do that. And so before this before picture, we started her on a bunch of things. We started doxy, spironolactone, adapalene, BPO, a topical clindamycin. And then she came in and she looked like the photo on the left. And so her acne actually got a little bit better, but she had a lot of post-inflammatory erythema. And so then we started her on, we just added in the Silagen acne scar cream, and that she started using twice a day. And this is 1 month after she started using the medicine, in the photo on the right, and she has significant decrease in her post-inflammatory erythema. I actually was surprised how good she looked in just 1 month of using the product. So she's super happy. And here's the side photo. And this is 1 month of using the acne scar cream. So she had amazing results, and we added nothing else except that, twice a day. And then this is our third patient who we recently saw. She did have pretty severe cystic acne. She completed isotretinoin and then came in and just had a lot of post-inflammatory erythema. And I see that actually in a lot of patients who are post-isotretinoin. They just have this lingering erythema that takes a really long time to treat. And so we started her on the acne scar gel, and this is her a month later after using it. Her erythema is significantly reduced. And so she can see she has quite a bit of scarring left over that she'll probably need some other interventions in the future, but she's only used the product for 1 month. So I imagine she'll get much more improvement even. And this is her same photo a month later. So here her erythema is significantly decreased. And there's her other side. So it's shocking, you know, at a clinical level, just after 1 month of using it, they look a lot better and they're very happy. So the ideal patient for this product is the post-acne patient. So these patients who have pretty inflammatory acne, and we can control that with other treatments, and they come in and they just have this erythema or post-inflammatory hyperpigmentation that's harder to treat. I think this product is amazing to use in these kinds of patients who have kind of grown out of their acne, or we've treated their acne, usually in adults 20s and up. But as you could see, I used it in a younger population, and it works well in them as well. And even in patients who are still dealing with their acne-prone skin, because it helps significantly with their erythema. So again, the ideal patient is current or former isotretinoin patients. And what's nice actually with the product is it has kind of a greasier texture. So if you wanted to use it, I haven't used it yet in patients on isotretinoin. I'm using it mostly post isotretinoin, but they could get a little bit of hydration from the product while they're using isotretinoin. That's one of the difficult problems with these patients on isotretinoin is they're very, very dry. And so I think this product would be helpful. And you can use it on all Fitzpatrick types really, but even specifically on Fitzpatrick's 4, 5, and 6, who have to deal with a lot of PIH, it can be very helpful. And then patients, you know, when they have acne and acne scarring, they have a lot of social anxiety. And so I think this is super important to add to their regimen. Yeah, so don't overlook the socioeconomic and psychological factors when dealing with acne scar treatments. A lot of patients are embarrassed, you know, with their acne and then their acne scarring. They're seeking all these different procedures. And sometimes they're scared to have lasers or microneedling. They don't know if it's going to hurt or what their aftercare is. And these procedures are also pretty expensive and sometimes they can't afford it. And so the acne scar gel is super helpful for them. And I do see actually a lot of patients who come in and they're spending tons of money on all of this stuff that they're seeing on TikTok and Instagram. And, you know, when you go to Walgreens, there's just a plethora of stuff to use. And so I think offering our patients something that actually works is helpful. And, you know, it's just one product that can affect a lot of different parts of their acne. And again, you can use this. I think this product can be pretty helpful post-procedure as well. So a lot of times if we're doing a CO2 procedure or a microneedling or all these laser treatments, you can have some residual erythema afterwards. And this product can be really helpful. I actually used it on myself. I had a micro coring done, and you can get post-inflammatory erythema that lasts for months and months after the procedure. I think that's the hardest part. So I started using this after seeing how it helped my patients, and I think it really helped with the erythema. So from personal experience, I think it works pretty well. And so it can be your all-in-one treatment. And so instead of spending all this money on all different products, you know, this one product has your vitamin C. It has an antioxidant. It lightens and brightens the skin. And so they really just need one product. And it prevents overuse of all this other stuff. It simplifies their routine. And that's it.
All right. So let's get started with some questions. If you guys have any questions, please put them in the Q&A. We got quite a few questions here. So let's start. How long do the results last after stopping the product? Do you have the patient stop after 12 weeks, or do you combine this with other topicals?
Well, you know, the study was designed for only 12 weeks. But the you know, the interesting thing was patients asked for the product after. They wanted to keep using it because they had such great results. So we had to supply them with product, even though that was not part of the study. But, you know, as far as we could tell, you know, while they were using it, it lasted. So we were very happy. And in some cases, actually continued to improve if they hadn't had complete clearing. They had significant improvement, but say they had a little bit of pigmentation remaining or erythema, it really cleared it up. So it really works very well. There's no downside. We haven't seen any side effects from it. And people are really happy with it. Very easy to use.
Okay, so we got a couple of questions on how you would layer this and use it with retinols for acne and for scars. So you guys want to both take a crack at this one?
So I would personally have them use, like I still have them use a retinol, and I have them apply the retinol first because the retinol, you only need a tiny, tiny amount for the whole face. And so I have them do that first and have it absorb and then do their Silagen acne scar gel because it is a little bit greasier of a texture. And so it can be very moisturizing. So I have them do that on top.
Yeah, I mean, I think, you know, we haven't really tested how it works for acne itself, aside from acne scarring. We did see, you know, a patient did say their acne improved because they weren't using any other products at the time. But you can certainly use, you know, your acne products at the same time and like Lori was saying, that, we just, apply at different times of the day or layer it.
Have you used this in conjunction with chemical peels?
I don't really do a lot of chemical peels. We do, a lot more laser work and, fillers, things like that. So I don't do a lot. So I really can't comment on that.
So
Okay.
Is there any reason
I,
why you couldn't do it though?
Mhm. Yeah,
Lori,
you
what do you
could
think?
use it. I do chemical peels in the office quite a bit, but I usually have them hold everything until their skin has flaked off and healed, and then they can resume their product. So I probably wouldn't have them use it during that flaking stage, but then they can just resume right afterwards, and it probably will help them with some of the redness and maybe even prevent some of the PIH and the darker Fitzpatrick types.
Right.
Okay.
In terms of patients who I may be doing laser, for really deep scars or microneedling, usually you can do it between the treatments, but, if you've had a treatment, I would wait until it's completely healed before you start using that product or any other product. We don't recommend starting acne products right after laser treatments until people's skin is back to normal because it can be irritating and delay the healing process.
Okay, we got a couple questions. A couple people asked this question. Do you ever use it with rosacea patients specifically for erythema or
That's a great
I've,
question.
mhm.
Oh,
I've,
sorry, you want to go,
oh,
go
go
ahead.
ahead.
Yeah, no, I was going to say that that's, probably a great idea for the next study. I think I've recommended that because you can see the significant improvement in the redness and erythema from the acne. So I think this would be a great product for rosacea as well.
And
What
I
do you think?
agree. And I've actually started telling patients with rosacea, especially when they have all those little pimples, maybe not so much for that vascular component. If they have all those telangiectasias, it's not going to help. But if they have kind of that inflammatory type of rosacea, I've started telling them to use this product because I think it makes a huge difference in that erythema. It really decreases it fast.
Mm-hmm.
All right, we got a couple questions about do you recommend it for a patient who has been on Accutane or hasn't been on Accutane? Got a couple questions about the use with Accutane, how you recommend with and without Accutane.
I usually recommend it post Accutane. So that typically when I put a patient on isotretinoin, I have them stop everything except for, very moisturizing products and just focusing on moisturizing their skin and gentle cleansers. And then usually a month after they've stopped isotretinoin, typically I would start them on a retinol. But now I've started, on that visit where they're done with their isotretinoin therapy, a lot of these patients have a lot of erythema left over. So I've started having them use the Silagen acne scar, like as soon as they stop using their isotretinoin. And I'm probably going to suggest that they start using it even during isotretinoin treatment because it's not going to dry out their skin. And it might help with some of that erythema, but I haven't suggested it yet. I think it would help.
Is the product safe for pediatric use and also pediatric rosacea? Trying to
Well,
combine some of these
it really
questions.
depends on the age, people, but I think we got to do a study there to see exactly how safe it is. Obviously, I think for teenagers it shouldn't be a problem, but talking about really young kids, I think it should be fine. But we can't say for sure because we haven't really tried it.
Okay. What kind of acne scarring do you find it helps with the most?
Well, certainly acne scars that have pigmentation changes and erythema, boxcar scars, atrophic scars that we've seen improvement. I think ice pick scars is one area that, it's very tough with any treatment to improve. So that's been my experience. But certainly appearance gets better.
Mm-hmm. Yeah, I agree with that. I think it helps really well with the pigment part of it. But more of that atrophic scarring, sometimes they need some procedural treatments to fix that.
Okay, I know we touched on this, but this is a pretty specific question. How should patients incorporate it into their acne regimen time-wise? Immediately after using PM retinoid, etc., or should patients use it at separate times in the afternoon compared to their other topicals? What are your thoughts there?
I don't know if in the studies it really matters. I have them do their routine all together. So like their morning routine, I have them use it kind of at the very end. If they're using, I have everyone use everything from like serums first, and then their prescriptions, and then they would use the Silagen Scar Gel. And if they need a moisturizer and sunscreen last, that's kind of the treatment I tell them to use in the morning. And then at nighttime, I have them wash their face and use their retinol first, and then usually they don't use the serum at nighttime, and so they would use the Silagen scar cream and then a moisturizer if needed.
Okay, we always get this question. Is it safe during pregnancy?
I would not suggest using it during pregnancy. That hasn't been tested. It could be, but again, that's always iffy.
Okay. Which sunscreens do you recommend? I guess with using this product.
Well, obviously, in the study we used the Silagen SPF 30 sunscreen, which was very effective.
All right. On average, how long did the patients need to use this product before they first started noticing improvement in their PIE or PIH?
We saw, I mean, all those photos, the before and afters were 1 month for all 3 patients. So within a month, and I was actually shocked in the very beginning that they had such significant improvement so quickly. So even a month of use twice a day, I think your PIE especially really improves.
Yeah, and that's what patients told us also, that they really started seeing improvement at 3 to 4 weeks after they started.
I know you guys touched on this a little bit. Is there any plans to do studies with this gel against other topicals or modalities?
Well, we'll have to ask New Medical, our sponsor, who sponsored the study, if they like to do that.
All right. Well, we will
Come,
keep
Wiley.
everybody posted on that. What else we got here? What is the best place for patients to obtain the product, and what is the price point?
So I think it's only sold through physician practices or right now. And so a dermatology office, plastic surgeons usually carry at least the Silagen line. And price wise, it's I want to say like 115. I can't think of it right off the top of my head, but it's around 115, 140, something like that.
Okay. Somebody might have missed this. Is there frequency of usage? Is there any differences depending on the condition?
Well, we used it twice a day in the study, and that's what we found to be very effective.
I think. Okay. How long does a bottle usually last a patient? We got a couple of those. Or how long does one?
Well, it depends how much you slather on. You don't need to use a lot. They say 1 pump will, be effective for the entire face. You can use less if you don't have acne all over. And then it depends if you have it on your back or your chest. And you can certainly use it anywhere you have acne, on your face and on the body. But, I think, we just found 1 pump, and that covered the entire face. What was your feeling, Lori?
Yeah, same thing. I'm trying to think because I did use it myself for about a month, and there was still some stuff left in the bottle, but I would do 2 pumps and put it everywhere. So I think you get more than a month out of it, even with 2 pumps twice a day.
Okay, great. We have some individual questions that will get the New Medical to answer directly. Leslie, well, if you have any more questions, jump in now. Best place for patients to obtain the product.
So I don't think they can get it online. I don't believe we sell it in our office. So
You can probably, check with New Medical on their website. I think that's probably the best place to find out exactly.
And everybody's emailed their website, so they have it, and we'll send a follow-up email, and everyone that has been on here for the full time, the first 200 people will get a product. And less chance for questions. We're running out of time, and I think that's it. That's well, I want to thank both of our wonderful speakers. This was really, really informative. We want to thank Silagen for putting this on and having this wonderful new product for, you know, people that have these acne scars and other scars. That's pretty much it. If you have any questions, you can email us. You can contact them directly. They have a website full of great information and podcasts and videos, and obviously their Instagram as well has a ton of information. Like I said, if you have any individual questions, we'll get those answered to you. Well, thank you very much for attending, and thank you both for your wealth of information.
Thank you for having us. This was great.
Thank you very much.